I don't even want to think about it. Good morning, everyone. Welcome to the Tuesday meeting of the BOCC. We don't have invocation today. We had a gentleman sick. So if we'll start with the Pledge of Allegiance, if you want to join me. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. Okay. Go ahead. I'd entertain a motion on approval of the minutes from December 8th to 10th.
Make a motion to approve the minutes of December 8th through the 10th, 2025.
Have any questions, comments on minutes? Okay, seeing none, we'll call for a vote. Those in favor? Aye. Thank you. I'll run down consent agenda. Before I do consent agenda, I will pass on at 9:30 today. We have a public hearing. Health and Human Services will be going over the local homeless housing plan. And at 10 o'clock today, we have a work session with Kelso School District on homeless housing. Okay, consent agenda. The first two items through Health and Human Services, these are extensions of past approved projects that are working through the process, permit process and whatnot. One is with CAP on the Kelso Senior Housing project that we gave some money to. And one was with Habitat for Humanity on a housing project for, I think it was old Kelso High School property, whatever they're working through the city of Kelso on. Sheriff's Department, we have addendum 1 to a personal service agreement with Northwest Enforcement for guards, supervisors, and a contract-owned vehicle for security at the jail. The total this coming year will be $530,096 for guard supervisors and $19,458 for a contractor-owned vehicle. This is when we signed this contract, this is a 1-year contract. The one that came due, we had a CPI bump of 2.7% over last year is what this is. And the total cost is going to be less because we won't have service at the administration building next year. Finance, interlocal agreement with City of Castle Rock to provide district court services for 2026. I think we still have Kelso and Longview to come in. Resolution to certify special district levy. The special districts are all doing their budgets. We certify them. Board letters and executed contracts and resolution. Affidavit of posting resume for the months of October and November 2025. Retirement letter to Kathy Funk Baxter, thanking her for her services in the finance department. Letter dated 12/8/25 from the Cowlitz County Fair Board regarding the Expo Center budget. Federal Energy Regulatory Commission, FERC, notice 12/3/25 regarding station 69 +00 sinkhole repairs on Swift number 2. Another FERC notice dated 12/3/25 regarding the canal preferential seat path mitigation, also on Swift project number 2. And then a signed resolution declaring a disaster regarding flooding in Cowlitz County and notice of emergency meeting on December 8th, 2025. And last week we had vouchers in the amount of $8,776,737.93. That's consent. Questions, comments on consent? Yeah. We're gonna celebrate her, I think, on Friday.
Thursday.
Sorry, Thursday. We're gonna celebrate you on Thursday. Yeah. Okay, seeing none, we'll call for a vote. Those in favor?
Aye.
Aye.
How about I move approval of the consent agenda?
Oh, thank you. Don, you got me sidetracked. Okay, we have a motion to approve. Thank you, Commissioner Farrell. Okay, we'll call for a vote. Those in favor?
Aye.
Motion items, Public Works.
Good morning, Susan Eugenius County Engineer. We have before you today, excuse me, an amendment to an existing contract that we have with Terracon Consultants. This is a contract to provide us special inspection services during our large construction projects. We're asking to increase their amount by $150,000 and extend the expiration to December 31st, 2027. They have been under contract for 2 years. We have completely obligated their funds. They come out and do special testing such as collecting concrete to make cylinders when we're doing large concrete pours and then testing them and make sure they come up to strength. Grout cubes, they do compaction testing for us because we do not keep a nuclear gauge on hand. So on a larger project, our task orders tend to be about $35,000 depending on what we're doing. So we're anticipating over the next 2 years, we'll need about $150,000 based on the projects we have on the schedule.
Okay. Questions on that? Okay, then entertain a motion.
Move approval of the motion item number 8, Public Works Amendment number 1 to the personal services agreement with Terracon Consultants.
Okay, we have a motion to approve item 8 with Terracon Consultants. One more call for questions, comments on that project. Okay. Call for a vote. Those in favor? Aye. Thank you, Susan.
Thank you.
Got almost a page from HHS.
Good morning, Gina James, Health and Human Services. We do have several items on the agenda this morning, but several of them are also related. So we'll go through a little bit here. The first item is on its own. So this is our contract with Prevention MD, which is our health officer, Dr. Krager. We have been working with Dr. Krager for a couple of years. The Board of Health appointed him a couple of years ago. He's available to us 24/7, provides medical oversight, oversees birth and death certificate issuance, as well as is our authority around certain functions we do around restaurant inspections, solid waste complaints, communicable disease, that type of stuff. So what we have on the agenda today is his contract was set to expire in December, so we're issuing a new contract. This is for a 2-year period. So that contract amount listed here just under 160,000 is for a 2-year time period.
Yeah. You need to do it at the mic because
I like him. Don't get me wrong. I do. He's really cute. However, I need to say, is this a part-time position that he has with us, or does he have a full-time job besides this?
So the health officer role is really unique because it's not necessarily connected to it's a full FTE, it's a point FTE. He's available to us 24/7. So we call him, and it's rare, but we have had to call in the middle of the night and that type of thing. So that's a big piece of it, is that availability 24/7. And then he is available to us. You know, we have standing meetings with him. He's on site as well. And
So about how many hours does he work for this $159,000, almost $160,000? I'm sorry, but I'm really a tight person, as you know.
Mhm. Yeah, I know, I understand, and it's, you know, physicians are spendy. We have to have a physician, so it is costly. I don't know an exact number of hours off the top of my head. We could go back and look at all of our meetings and consultations and all of those pieces and his time on site and attending, you know, coming to Board of Health and all of those pieces. So I don't have a good number for you.
Okay, I just had to ask because if he had a full-time job and this was only a part-time job, even though on call,
Mhm.
that's a hefty amount of money.
Yeah.
Did, just for a little history, I think this went out for bid
Mhm.
when we did this.
Mhm.
And prior to this, we had an agreement with Clark County and shared their person, which he was part of that.
Mhm.
And if I recall right, we were paying the same amount for sharing a person. It was about 80 a year.
I think it was close to the same.
Yeah.
I can't remember now off the top of my head. Yeah. But we appreciate the relationship we have now and working directly with
Yeah.
Dr. Krager.
And so while the dollar amount didn't go down, he's on call to us 100% of the time
Mhm.
versus when we were sharing with Clark County. So I'm just offering some history is all. I'm not suggesting anything.
Yeah.
I'm just,
And we didn't get a lot of applicants when it did go out to RFP either.
yeah.
Yeah.
Okay, any other questions on item 9? Okay, I entertain a motion.
I move approval of item 9, contract with Prevention MD for health officer services.
Okay, we have a motion to approve the contract extension with Prevention MD. Any other last chance? Okay. Okay, we'll call for a vote. Those in favor? Aye. Gina, 10, 11, and 12 are all connected. Maybe kind of just explain them all together.
Yes, so item 10 is a contract with Washington State Healthcare Authority. This is passing some state funds down called Criminal Justice Treatment Account funding. This funding is specific to providing substance use disorder services to individuals involved in our criminal justice system. A bulk of it is more specific for individuals participating in a local therapeutic court program like drug court or mental health court. Granted, they have to have a substance use disorder to be eligible for this funding. It pays for treatment primarily. So we're talking about substance use disorder assessments, outpatient treatment, inpatient treatment, case management, that type of thing. The purpose of the funding is to help individuals complete their treatment program and complete their drug court or mental health court program. Oftentimes, for these services, the providers that we work with, which the item 11 and 12 are, we're passing some funding down to Columbia Wellness and Cowlitz Family Health Center, who provides those substance use disorder treatment services to the individuals. They do bill insurance first. So if the individual receiving services has insurance, they will bill insurance first or help them get connected to insurance. Oftentimes, when an individual is participating in a therapeutic court program, the court program requires more treatment than what insurance will cover. And that's where this funding comes in. So it's to support individuals to be able to complete their treatment as required by their court program so that they can be successful in that program. So as I mentioned, the 2 pass-through contracts with Columbia Wellness and Cowlitz Family Health Center are to provide those substance use disorder services for individuals involved in our criminal justice system.
do we have a role in picking like Columbia Wellness or Callis Family, or is that, does the healthcare authority, they generate these funds and say it's coming down for these, they pick these agencies?
They don't pick the agencies. We do have, that's within our scope. We have issued an RFP in the past and we have gotten the same providers
Okay.
interested, but we could consider others if we'd like to as well.
Gotcha.
A question about the services. Since I just heard, I think you said they are court-ordered treatment services. And so do we keep record or know how many of the clients actually finish their treatment and how that is monitored and observed for us, the citizens that are paying?
Yeah, so it's harder to do that with this funding because this funding is paying for a sliver of the treatment overall. It's sort of filling in the gap. Drug court or mental health court may have better information in terms of who's completing the whole program or their treatment provider who's providing all of the treatment. This funding, as I mentioned, is sort of filling in the gap beyond what insurance isn't able to cover.
But for the completeness, or let's say the total services out of Columbia Wellness or Family Health Services, they would be providing a total service under a court order, I presume.
For someone's treatment, yes, they would be providing the full scope of their treatment.
So as you just said, you're participating in the selection of them.
Mhm.
I would presume that part of that selection process would be say, well, just give us a summary of the completions and the fulfillment of these obligations from court order. Have you seen anything like that as a report on the completeness of their services?
Not from the provider. I would probably look more to the therapeutic court programs to answer that in terms of completing what's court ordered, because they would be the ones sort of keeping track of what is court ordered and then what's being completed. I think that's how they help determine who graduates from those programs.
Okay, so I'm just sitting here, I'm a little suspect of the fulfillment of court orders because it only gets fulfilled if somebody is making sure that it gets fulfilled. We see variances or issues where the court orders are not being implemented.
So Ron, let me, if I may address
Sure.
that. I've actually brought this up in our behavioral health meetings with Great Rivers. And it's pretty frustrating because I found out those systems are not even set up to track what you're asking. So we would have to implement some sort of a program to be able to track the success rate of those people. I didn't get a straight answer as to why they're not, other than they're just not set up to track that information and that data. Pretty frustrating. So I know that we talked about this with Gina yesterday with regards to being able to inject into these contracts things like a tracking metric so that we can see what the success of these programs is, because there currently isn't really anything that does that. They would have to go out of their way to provide us with that information as the way things sit right now. So it's one of the things that I am looking to move towards putting in these contracts, that there's some way to track what's happening inside of these contracts with the people in these systems and programs.
Okay, I hear you. So under the three simple words, truth, transparency, and ultimately accountability, we need to support you in doing those or whatever you need as our commissioners and leader of this. Because ultimately, if we don't get to accountability, we really can't gauge or understand success or failure of success. So thank you.
Okay. Any other questions regarding this? Okay. I'd entertain a motion if the board so desires. We could probably take all three if you wanted.
I move approval of items 10, 11, and 12, contract with Washington State Healthcare Authority, contract with Columbia Wellness, and the contract with the Cowlitz Family Health Center.
Okay, we have a motion to approve items 10, 11, 12. Let's call. Okay, call for a vote. Those in favor? Aye. Thank you. And 13, 14, 15 are all related, so maybe.
Yes, so items 13, 14, and 15, these are contract amendments with the providers that we've been working with for coordinated entry. So it's with Cowlitz Family Health Center, Emergency Support Shelter, and Community House on Broadway. And what we're looking to do with these amendments is just add a 6-month allocation. What you see in the totals here then is the total contract amount. That's not the 6-month addition. That's the new total contract amount for now, what would be an, 18-month time period. To align it with, we're funding these with our Consolidated Homeless Grant, which runs on the state fiscal year. We've made that transition the last couple of years. And so we're just looking to get it aligned now with that contract and that funding cycle with these amendments.
Okay. And to expand just a hair on Commissioner Rader, during the 6 months, we talked yesterday about a workshop to try and interject some of that language we were asking for before that comes up again.
Yeah, so we can do that the first part of the year, yeah.
Questions on those three? Okay, and entertain a motion. And once again, if you're comfortable taking all three, we can do that.
I move approval of items 13, 14, and 15, contract amendments with Cowlitz Family Health Center, contract amendment with the Emergency Support Shelter, and contract amendment with Community House on Broadway.
Okay, we have a motion to approve the consolidated entry contracts for Family Health Center, Emergency Support Shelter, and Community House. One last call. Okay, we'll call for a vote. Those in favor?
Aye.
Aye. Thank you, Gina.
Yeah.
We have you in just a couple minutes, don't we? I know we had a couple questions last week. I still don't have numbers for everybody on as far as COG goes. I gave you numbers for Cowlitz County, and I'm sure Castle Rock has numbers. I think their final meeting is coming up. I just saw a thing where they're going to approve it. And then you had a question on, and you have Commissioner Rader today on that one letter.
Spanish Castle.
Yeah.
Yeah. So that is a request from the Department of Ecology to give input on, there's a vineyard that is wanting to take water outside of the scope that they currently have. So they're wanting to expand the scope. Currently, they take water from wells to water the vineyard. They're expanding the vineyard and they're wanting to take water from the Columbia, and they're wanting to know the effects of the current and that kind of stuff, if it's going to affect the Columbia River, the fact that they're taking water out of it to water the vineyard. So I went through and read some of the WACs and the RCWs that they have given me to go through and to research, and they're just asking for our comments as far as what does Cowlitz County feel about the situation and the issue. So I'll be responding to them in the next 2 weeks.
You think it's a wonderful idea, don't you?
What's that?
You think it's a wonderful idea, don't you?
Take water out of the river. I think that God gave us resources to use.
I think it's a wonderful
Yeah.
idea.
So
No, and I just wanted to comment on Rick in that letter. That wasn't what I was expecting, but it's a great start. I thought maybe that COG would tell you people what everybody's paying is what I was thinking. And no, it hasn't been brought to our coffee group what Castle Rock pays yet, but I'm sure it will when I throw that out on the table one of these days. And It's a great start to expose the shadow of government that COG is.
I,
It's a lot of money.
I do know we're one of the higher assessed.
I'm sure you are.
Yeah,
But it's a lot of money, and you start adding up every jurisdiction in the county, it's a real bucket of money.
yeah.
Thank you.
Mhm.
Thank you very much, Steve.
Hi, guys. I got two items today and,
Yeah.
and I apologize right now because I've got a headache and induced grouchiness coming on. My two, the first one is my husband heard that the Corps of Engineers will not do any dredging this year. The second is my one that I nag you guys on constantly, and I just have to put another nagging in. Last Tuesday, I brought up the fact that when we had finance, and I know that's too late to do anything with that, but I want you guys to think about the juvenile hall. Okay, let me give you a little history. In 1999, my husband worked there. At that time, they had 4 pods. They reduced it to 3 pods because they opened up some walls and made it for educational rooms. But at the time they had 4, they had 64 beds in that juvenile hall. Right now, as last week she was talking about, sometimes we have 12, but mostly we have 6. Now if this was run by a private enterprise, somebody would be fired because it was over $3 million a year for those 6 kids. It does not make good financial sense. If we farm those kids out, let the jail bring the fragile mental person into that, or another, however they want to do this, they would have a lot more jail space. We could open it up to, private enterprise. 64 beds is quite a few. But somehow we could use that facility a whole lot better than what we're doing right now. Right now, over $3 million. Let's just say 4, okay? That's a lot of money. And our county can't afford just to, just throw it away for 6 kids, 6, 8, 10, 12 kids. We could farm them out for like $300,000 a year tops, maybe a little bit more, but that's a whole lot different than the $4 million that we're putting out right now. So it's feasibly ridiculous not to do something with that facility. Also, the Public Corps of Engineers, somebody has to get a hold of Trump and say, hey, we are living on the edge of a problem. It could be a catastrophe. This is not just something they can willy-nilly say, no, we can't dredge. They should not have the option of saying no to something that's this possibly damaging to our community. Anyways, I'm sorry I'm cranky, but these 2 issues are near and dear to my heart. Again, I hate waste and I'm very tight. I'm very cheap, I'll put it that way, or however you want to put it. But please do something about those things, please. And I'm going to take one of your candies. I got my headache.
It's public hearing at 9:30, so just,
Very quickly,
I'll
Chioka,
try
a
not-
couple of questions.
Yeah.
Is moving the juvenile hall into a different building that's a lot smaller and a lot less money, is that even realistic? Is it a possibility? And what about contracting with maybe you already do this, contracting with all of the other counties to bring the juveniles here so we actually have more? Are those even realistic, or maybe you're already doing that?
yeah. I can tell you, since I've been sitting here, we've been looking at different options for that all the time, because the way it is, we have looked at what we have available to move into. We really don't have a lot. We do contract with a couple of counties in Oregon. We contract with, I think it's Clatsop in Oregon and Columbia. I think those are St. Helens and Astoria. Contract with Kayakam Pacific to take their kids, and it still doesn't add up to a lot.
Okay.
We're always looking at, under state RCW, we were required to have it because our county population is over 50, but
Yeah.
we have explored with other counties to see if we can kind of because we're not the only county that is facing some of that, right?
Yeah.
See if some of that can be changed. We've talked to our representatives and told them we need some change in legislature for that. Yeah.
Alrighty, thank you.
Mhm.
The one thing that I would add to that, Dawn, is because of the financial crunch that a lot of counties are now feeling more so than ever, some of the ones that may not have been receptive in the past are starting to be a little bit more receptive. So
Yeah.
hopefully that we can make some ends there.
Yeah, good point. I think we really see it as a win-win. I mean, we save some money, they save some money.
Yeah.
But just a matter of getting it done, right? Okay, I think we're at 9:30 and we need to move into the, Gina? If we finish this before 10, we'll open up for public comment again if you want to do some.
Okay, so today we have a public hearing for our 25 to 2030 local homeless housing plan. I do have some hard copies up here if any folks from the public would like to. It's also posted on our website and it can be viewed there as well. This is our second time kind of taking a look at this plan. We met a couple weeks ago with the board and went through it once. Just as a reminder, the Homeless Housing Task Force has spent the good part of 2025 working on this plan and providing input to what they would like to see in this plan. We also have to incorporate some items that are required by the Department of Commerce as well. So this reflects both those requirements and what our Homeless Housing Task Force has provided in terms of input and what they would like to see. So the purpose for today is to take another look, get any input from the public, and go from there. We do have to have the plans submitted to Commerce in December. So I'm hoping we can meet that timeline, but we also, it's our plan, so we can make changes to it whenever we'd like to. So I want to keep that in mind as well.
How long are these good for? Typically, how long did the last one run?
They call it a 5-year plan.
5-year
It's
plan?
about 5 years,
And
yeah.
and during that 5 years, things change. You're basically telling us we can make some tweaks to it.
Yes.
Okay.
Yeah, it's our plan, so we still have to have those components that the state requires, but beyond that, yes, we can, it's our plan, we can make changes as we'd like. And we have in the past, from time to time. So I'll just do a brief overview as a reminder. There's some historical information, kind of a narrative section in the front. Do you all have a copy or do you want a hard copy? I don't know, or we could get it up on the screen maybe.
I'm good with it on the screen.
Okay. Okay. I don't like talking about something you're not looking at.
Thank you for that.
Well, that's getting up. We, as I mentioned, there's some narrative pieces in the beginning. I'm not going to read through all of it. It just kind of talks about who worked on the plan, the task force, what can be included in the plan, those types of things.
Maybe explain the significance when we have this plan and some of the funds they send us for different areas. The spending of those funds have to align with whatever we accept here. Am I close there?
Yes,
Yeah.
so for our local document recording fees, we
Okay, for document record, okay.
Yep, for document recording fees by statute, we have to allocate that funding in alignment with what is in this plan. So that's really one of the big things. And for that purpose, and you'll notice we've had some conversation about this in the past as well, that there are some items in here that probably feel a little vague or broad, and that's to give us the most flexibility so that if we are considering funding a project, that we have some room to make sure it fits within this plan. So we could certainly be more pointed and narrow things down a little bit. That's kind of part of the reason why some of it may feel more broad. So what we have in the plan with the goals, which starts on page 3, there's 3 goals in the plan at this point. Number 1 is increased training, education, and job skills opportunities. This really came from the Homeless Housing Task Force. There was a lot of conversation and discussion about the importance of education and training for individuals, learning how to be good tenants, learning about how to manage money, learning about workforce, those types of things. So a lot of discussion around that. And that's what this first goal is really centered around. It's Flo. Thank you, Flo. Goal number 2, support a homeless system focused on self-sufficiency. There was also a lot of conversation in the task force about wanting to support projects or programs that have a focus on self-sufficiency, that folks may need some temporary assistance to get back on their feet, but the goal is really that transition back to self-sufficiency. So that's what that goal is centered around. And then goal number 3, increase access to affordable housing. We had this on our last plan as well, just kind of a acknowledgement that housing is a need in the community, that there's high demand for housing, and having units available so that people can be self-sufficient in is a need, continues to be a need in the community. So that's on there as well. There are several components. There's in the appendices, there are a lot of informational items within there. Resources that our community has are listed, as well as some required components from the Department of Commerce, some different tools and analyses that they do that we're required to include as part of our plan. So those are included in the appendices as well. And I'm happy to go through those in more detail if you'd like. But I may just stop here and kind of get some initial thoughts or feedback or questions from you all.
I think we're good.
I'm happy to make changes. So if there's something, if your wheels are turning and there's something you'd like to see different, we can certainly do that. Like I said, for today, we're just hoping to have some more discussion, hear from the public, and we can continue to make some changes if we need to.
Okay. Are you ready to open it up to the public?
Sure.
Okay. We'll open up the public hearing to any public comments you have on this.
Good morning. Thank you, Gina and commissioners. Your introduction, it says the homeless housing plans must be consistent with the statewide strategic plan developed by the Department of Commerce. Is this integrated or consistent with the federal HUD housing and?
So our requirement is that it aligns with the state strategic plan. I believe the state has to be in alliance with the federal plans. But all I know for our requirement is we get these requirements passed from the state that we have to align with the state strategic plan. I'm not sure what that looks like compared to the federal plans.
Okay, so let me make a statement of consistency then, is that I presume it should be in alignment with our federal regulations for housing and urban development. And does the name Scott Turner, Secretary of HUD, ring a bell? He recently made a statement, clear and concise. Our housing and urban development funds are to be dedicated to the citizens of our country. That's a very definite, precise statement, and I would like to follow through and make sure and find out how we are consistent with that.
Morning, Commissioners. Jordan Wisdom with Community House on Broadway. We just want to thank the task force and the department and the Commissioner Board for working on this plan and pulling together a really comprehensive look. Community House on Broadway supports the 3 goals outlined here. Specifically, as Community House on Broadway is a homeless recovery provider, we believe in a hand up, not a handout, and that those missional goals are very much in alignment with what we've read in the draft proposal, the 3 goals, specifically relating to self-sufficiency and ensuring that individuals that find themselves homeless are given the tools and the resources and the wraparound care and the accountability and a little bit of grace that comes along with it to achieve their desired outcomes of being stably housed with their family, but also being self-sufficient in that for the long haul and to reduce recidivism back into the shelter and the community safety net system. So as we serve individuals in our 3 shelters that we operate here in town, that's our goal. And that is always our missional driver, is that folks have access and accountability in engaging in those wraparound services for job readiness, obviously home, getting into stable housing, but also working on their mental health and substance use recovery needs as outlined by the Community House's program requirements, that folks are engaged in those services. I did have a question of clarification on, I think it's page 2 or 3. There's some bullet points. It's the very top of page 3, but eligible activities under the plan per RCW. The 3rd bullet is operational subsidies for transitional housing or permanent housing serving formerly homeless families or individuals. And I was just curious if in goal 2, it does talk about both short-term homeless shelter and then also more the transitional, the longer term. Transitional housing. Would the short term up to 90 days stay, which would be the Community House on Broadway model, be included in that 3rd bullet? Potentially for, would this encompass activities as such?
Yeah, so more so the bullet points that you referenced are sort of what is eligible to fall under the plan and to be funded under the plan. The plan itself is really where we have to look to seek alignment.
Specific alignment. Okay.
And it would be for local document recording fees. Our consolidated homeless grant, which is another funding source, is separate, and we just have to follow the constraints of that contract.
Gotcha.
Yeah.
Thank you very much, Gina, for that clarification. And thank you, commissioners, for taking a look at this plan and approving it and moving forward and supporting our community and our community members that are homeless at this time.
Thank you.
Thanks again. Just one little quick verification. You say units and beds. What is the definition of unit and what's the definition of beds? I know that's kind of a weird question, but I don't understand. I mean, do we have like 5 beds per unit? Is a unit a housing?
Well, and that's, let me look what I
Or maybe
put.
it's in there.
We did add something here. I was just going to read through it really quickly. Let's see. Because we did have that conversation about why are we looking at units and beds? What is the difference?
Yeah.
And some projects count units, some projects count beds. Let's see. So what I have noted here, not all projects count units and beds, and it could vary. For example, a project could have a single unit that could at one time include 1 bed or another time include multiple beds. So it really depends on the project. You could have 1 unit, which could be a room. That room could have 1 bed in it, or that room could have 2 beds or 4 beds. And so the different projects, because of their different funding or tracking requirements, may look at those differently.
Right.
So it is an important distinction in terms of when we're trying to count You know, people say heads in beds. If you're trying to get an idea of how many people a project could serve or what their capacity is, it's important to look at, is it units? Is it beds? What could that look like?
What could that look like?
Yeah.
Okay. And so then, and how do we track the recidivism rate? Is that actually tracked, or how many people are we serving over and over and over?
Yeah, so and let me just make a point of clarification on this sheet that you're looking at, this capacity. Cowlitz County is not funding all of these projects. This is just what is available in our community. What Cowlitz County funds is a very small portion of what is listed here. And we do look, for those projects, we do look at recidivism and what that looks like.
Okay, thank
Yeah.
you so much.
Yeah.
On that point, Gina, if I remember the conversation correctly, when we were trying to track how many people were being served,
Mhm.
and the difference between the units and the beds kind of threw us off, and we're like, how does this make any sense? So we wanted to conform, I guess, the way we were tracking that with units and with beds.
Yeah, it does throw it off, like I said, because the projects look at it different, and I mean, and it makes sense that it is different. But it does make it a little bit confusing. Yeah.
Any other questions, comments? Not seeing any online, so we'll close the public hearing part of it. Your guys' pleasure, if you want to approve that today?
I'm for approving it today, but I would just throw out that, in sitting in a lot of these meetings, I was actually pretty impressed with the conversations that the task force had with regards to making sure that they came up with a plan that was going to be good for our community and one that we could get results from. I mean, there was tears and there was frustration and there was some, what some might even perceive as contentious, conversation, but it was really good. And, I think it's a well thought out plan.
Yes, there's a lot of good conversation around this for sure, and a lot of importance, a lot of emphasis on it being local. Yeah.
Sure.
Move approval of the 2025-2030 local homeless housing plan.
Okay, we have a motion to approve the plan, the 2025 to 2030 local homeless housing plan. We've already had discussions, so we'll just go to vote. Those in favor? Aye. Thank you, Gina.
Thank you.
Okay, we have a few minutes before our work session at 10, so if we have any other public comments that we have some time.
Thank you. Let me follow up on the statement by our Corps of Engineers regarding the dredging of the Cowlitz River. The weasel statements that our leader of our entire area said he can't do anything for us because it would be inconsistent with other things throughout the country, and that he would then have to make justification. I think we need to put both our state senators and our representative directly on the line to see. They are the ones that can make the decision and for yes or no or whatever. So we've got to get a yay, nay from them directly and no weasel words. Where do they stand representing this whole issue of et cetera? I know it's going to be commingled with all of the other flooding in Washington State, but this has been going for over 40 years, and we need some people to stand up.
Morning. My name is William Gill. On July 25th, 2024, Como TV, a Seattle TV station, was dropped from Xfinity service. Como was the only Washington State-based station provided to the residents of Cowlitz County and Southwest Washington by Xfinity. Como is and was my only source for in-depth Washington State news, activities, events, and happenings in the state of Washington. It is a disservice to customers in Calais County to remove their only source of this information. This is especially of concern in election years. Xfinity customers in the state of Washington should be provided with broadcasting based in Washington State, specializing in Washington State news and events. Please amend the franchise granted to Xfinity and return a Washington-based TV station to the Xfinity channel lineup as a requirement for Cowlitz County service. Thank you.
Just making some notes. Anybody else? We have nothing else. We can take a quick recess till 10 o'clock and then we'll start the work shop with the Kessel School District. Okay, we'll take a quick recess. Okay, we're back from recess. It's 10 o'clock. Thanks for hanging around. Gina, are you kind of running this workshop? Or kind of starting it or something like that? Okay.
I will kick it off. I'm just going to give a little bit of background and kind of why we're here today, and then I'll have invite some folks up. So the Kelso School District had reached out a while back talking about a need they have. They provide some services to their students who are experiencing homelessness or at risk of being homeless. So they do quite a bit of work and connection with those students and families. So I have been working with them a little bit, just learning more about what that looks like, what the work is. I've also been talking to the state and getting some information about what that work is they do and how it aligns with our consolidated homeless grant to know if it's eligible for funding under the consolidated homeless grant. So what we've learned is that parts of the work are, there was still some work to be done in terms of exactly how much and exactly what duties, but it sounds like parts of the work can be eligible for the Consolidated Homeless Grant. So as a next step, we wanted to invite the Kelso School District here to kind of share with you about what that work is, what their need is. And so I will invite up our representatives from Kelso School District and let them sit here and share with you.
Okay, well, I want to touch a little bit, maybe they can, because I know there's under the McKinney-Vento, however you say that, there's a federal law that we have to do this, and there's also federal funding. So maybe we can address that a little bit. If there's federal funding and stuff for this, why are we seeing it?
Yeah, I'll let them speak to some
Maybe.
of the funding that they've seen and what's happening now with that.
Okay, all right.
Yep. Thanks. Thank you.
Oh, thank you.
So thank you for your question, Commissioner Dahl. To answer your question around the federal support, yes, it is a federal requirement that we provide McKinney-Vento services. So there's 16 educational areas of support that we're required to provide. Many districts will provide that through a stipend. So, it might be a school counselor that actually provides that on a smaller scale. What we've done through state grants the last several years, we were able to apply and get awarded those grants to fully fund a full-time position. That is not typical in most districts, but neither is a 100% graduation rate for our McKinney-Vento seniors. So we've implemented a system that is supporting through community partnerships, identifying and connecting resources to not only the students, but the families. And that's part of why we're here today, is we've expanded the position to meet necessary support needs for our students and families that are not required under the federal guidance.
Okay, so you're getting the federal funds for that. You just expanded the program and the state has provided these funds in the past, and for whatever reason, they're not this year.
Correct. That is
Okay.
correct.
Yes, I'll introduce ourselves. I'm Mary Beth Tack. I'm superintendent in Kelso. This is my 8th year and 35th year in the district. This is Gunnar Guttormson, who oversees the Family and Community Resource Center. He's our Student Services Director. So again, thank you so much for having us here to just do a short presentation. And I also want to just commend Gina James and her support and her feedback to us on this presentation. Thanks for all you do. And as you, in your role, champion the direction and the resources of our county, as superintendent, I look over that same thing, champion the resources and direction of the district. The McKinney-Vento is, when we talk about in Kelso School District, 100% of our graduation rate. We're committed to each and every student that enters our system will graduate and be post-secondary enrolled, whether that's apprenticeship, a trades, military, 2-year or 4-year. Our goal is to have them marketable and a contributing citizen. McKinney-Vento is some of that 10%, remaining 10%, and we commit to meeting the needs of each of our students. I want to share just kind of the 40,000-foot level of the data. 5 years ago, post-COVID, we know that there was significant need for our families in our community. We did put additional resources into this program, the Family Community Resource Center, to help support not only our students in prevention, but also their families. And going back to 21-22, you can look over the enrollment we have in our district, the enrollment of our McKinney-Vento that are unhoused or unstable housing, and then our graduation rate. In the low 80s is the state graduation rate. This past year, we had 91.4%, and a lot of that is due to the individual programs that we put in place in Kelso. I also want to draw your attention to the last 4 years. We've had nearly 100% of our students of our McKinney-Vento have received graduation diplomas and have been off to post-secondary enrollment. In 2022, 2023, we had 92%. We've been recognized as a state model for the work we do, and it is adding additional dollars to the federal funds for McKinney-Vento. That's been needed. And also when we created this program about 5 years ago, our goal was not to, we wanted to help put in place supports so that there wasn't generational unhoused or unstable housing for these families. And so you can look at the members employed. We do a tremendous amount to wrap around the family. And if there is unstable employment or not employment, we also actually employ those folks within our school district and outside of the school district. We have now just started tracking our post-graduation, where our students go that are McKinney-Vento. And as you can see, 100% of our students this past year were post-secondary enrolled. We're really proud about that piece. The last column I want to draw your attention to is the stable housing. F stands for families and S stands for student. So you can see that the work that we do places them in stable housing or consistent housing systems. So you can look at that data. So far this year, and we've only been in school for a little over 3 months, we have 16 families that have been, because of the work we do in the Family Community Resource Center, have been placed in stable housing, and 47 students. That's really important to us, and something that we will continue to champion outside of that. So that's kind of the 40,000-foot level of the program. I will have Gunnar Guttormson talk a little bit more about what that looks like, boots on the ground.
Okay, do you want me to go over the
Yeah.
one department? So earlier I mentioned the 16 required fields for McKinney-Vento liaison to support educational needs. What we see here is additional funding requests that we look at about 30%, anywhere from 12 to 15 hours a week. Our McKinney-Vento liaison is meeting the needs, working with community resources, housing resources. Currently, we have a grant through this year with Peace Health that supports rental assistance and deposits. So a lot of times our families that have multiple children within our district, they may be employed, and coming up with a large amount for a rental deposit becomes arduous. And so that grant is specifically designated to kind of supplement that, to get them the extra funding so that they can get into housing for that family. There are few instances where it's a family and one child. The stories that we get, it's multiple kids within our system. And we know that 100% graduation rate that we're seeing is a result of continued education. I mean, that's reason the federal has that. The federal guidelines are to have those rules in place because they know that stable education for a student results in a higher rate of graduation and secondary goals. So what our McKinney-Vento liaison has understood is that without these additional supports and connections and resources, because we don't have somebody that within our community that will connect, through a student and their family, the resources within our community. So because of that ongoing partnership and awareness of resources, she's able to do that. We see it as part of the service that we're providing for keeping students in stable education. That goes along with that stable housing.
So our request on the front page you'll see is $40,800 per year. That would be our ask from the commissioners and our county. I think we will get results. I would be happy to come back yearly to give updates of our data. I would love to give you a tour of our Family and Community Resource Center. It's something that we are very, very proud about, and it does meet the needs and services of our families.
Gunnar, how are you guys made aware of families that are in need, and what does the enrollment process look like?
So our process, so in our schools, so we have great partnership between our liaison and representation within our schools. So we educate our school counselors, our teachers, relationships with our kids are key. And then when we have staff that is concerned or has maybe ideas that a student is experiencing unstable housing, what they do is connect that family student to our McKinney-Vento liaison. An enrollment or a housing questionnaire is then completed, and our liaison helps with that completion to really understand and ensure that it's filled out authentically and the information provided is true and real. With that enrollment questionnaire, it helps us identify if they qualify for McKinney-Vento, whether it's an unaccompanied youth or whether the family is doubled up or whether they're living out of their car. So all of that, we get a better understanding through that questionnaire.
Is the family included in that process, or is it just reliant upon?
That is our priority. So maintaining, and that is constant messaging that we have with our McKinney-Vento liaison is family wholeness is treating the whole family is actually the mission of the Family Community Resource Center. Yes. So.
What is an unaccompanied minor?
So that is a student that is not living within the house. There are a whole continuum of conditions that result in that, and that's one of the aspects that we lean into in maintaining a whole family. Sometimes there are situations within a household that create an unsafe environment for students, and they may choose to leave, or that it's not sustainable, not meeting their needs. So there are varying situations and that we work to support students through.
So are the services limited to the student, or do you actually reach out and involve the family with the services also?
Yep, reach out to the family and provide services if at all possible.
Through the McKinney-Vento program?
Well, it's the McKinney-Vento serves the student, and that's where the housing stabilization often comes in, and the additional resources that we have. And so it's really understanding what what services can we provide? What connections can we provide to the family to stabilize housing and the educational opportunity for the student?
And Commissioner Rader, I'm glad you brought that question up because it's, we work really hard. We can always do, our goal is progress over perfection and in the area of family partnerships. And that is really a key component. So we continue to really make sure that that's happening.
So looking at the number of people you got, like you said, 3 months into the program for this year, are those numbers higher or lower than normal at this stage of the school year? Or is that average basically, it goes up and then kind of levels off? What is that?
Yep, we will anticipate, just looking over the last 3 years, we anticipate this will be a greater need than the previous year with 23 families and 66 students. Not sure if it will be as many as 37 families that we saw in 22-23. But the shortness of the program, it's hard to understand whether we have the trends, but it does appear to be a greater need or greater service than it was last year.
So how much, what's the expenses that you put into this every year? Since I see nothing here for historically what it's cost you each year.
Yeah, so that's what we're using the Peace Health Grant right now to supplement housing supports. So the deposits and rental assistance. The other thing that we help with is, or that we connect that resource to families is if they are in waiting for housing, so they've got a place that they're going to move, but they're staying in a hotel, that Peace Health Grant also supports that. That's a finite grant, and that's where part of that 15,000 is requested to be able to continue to do that work. The hours that the staff member is spending outside of the 16 responsibilities of the federal McKinney-Vento guidance around housing stabilization, 12 to 15 hours, and that's where that percentage of request is coming from for the total of the 86,000. So we are funding the McKinney-Vento portions of the job, but because we've expanded it during previous grant systems, we're looking to maintain that housing stability support that we're providing.
So just in a summary, last year we had 3 people running this program, and now we are down to 2. We already reduced 1, just in general context from budget reduction. So we have 2 people that really oversee and deliver this out of the in that result. So this is 1 person of the 2 that we're requesting 30%. But we have already, during budget reductions, reduced one of our leads in that program.
Well,
for
I
this
guess what
school
I
year.
want to understand is what your different sources of funding are and how much traditionally have you been getting from the county? You got a 4-year program here, 5-year program.
Mhm.
How much did you get from the county last year?
0.
Okay. What has changed that you're coming to the county for money this year that you didn't need it in the last 4 years?
We had substantial grant funding from the state that was not available to us anymore.
And I think our program really aligns with the direction of the 5-year program. I think there's pieces that we play a really crucial role in to help the overall health of our county. I think our program fits in really nicely with that path for prevention and support. Majority of our students live and stay in this county. This is where they want to raise their family and be a contributing member. And so this is a way in which we can help support the well-being of our county.
So in the past, the state has been providing this 40,800 or roughly somewhere in that neighborhood, wherever it is.
Yeah.
Yes.
And this is what I heard you say, that everybody does McKinney-Vento. All school districts do. You've added to it and yours is unique to the state. Did I hear that right? Is there not really? You're kind
Unique,
of something doing different than what other,
a unique and a gold standard, I would say.
okay.
Yeah.
And you're having this kind of results. I'm wondering why the state would pull this or they wouldn't.
So those grants they're not in service of housing stabilization. even though we've grown it outside of those parameters of the McKinney-Vento guidance, because it's meeting the needs of our students and families. Those with reductions in other federal dollars, more districts have applied for those grants, so they became much more competitive. We had a system that was awarded those grants over the last few years. But now with other districts that have higher percentage of McKinney-Vento or perceived greater need, it's become more competitive. So where there were much fewer applicants before, that's not the case.
And how do you work with other agencies in town? And I ask this because I remember when we were first looking at Beth Place, for example.
Yes.
I remember Kelso was in here and we talked about some of these needs. So how do you work with some of these other agencies? And I know Janice House does some stuff with kids, and
Yep.
and there are probably many more. And I'm just trying to get an idea of how everybody connects and works through this problem.
Yep. So one example that we have is a large family. So a single mother that has 9 children. And there isn't a housing partnership that provides housing for a family of that size. So 2 older kids were partnership through Beth's Place. So the 2 older students, to reduce the total size of the family, to be able to connect them with housing. So there's multiple partnerships in there and understanding of the housing possibilities for a family to be able to get housed.
Can you touch on, you've said that you guys expanded this program. At what point, is there a point, do you feel that the program might grow beyond the scope of its original intent? And what is the original intent of it? You know, schools, we're supposed to be educating people. Where do you see that this fits in to the education program model, if you will?
Yeah, that's a great question. And that's part of the reason, as we've done this work, you know, we know that if a student is coming to school, we can serve them. But if they're not coming to school because they have housing instability, or they move to a different location because they weren't able to get stable housing, or they drive to a different location because there may be different resources that they can access, that became very apparent that the only reason that we can continue, or the only way that we may be able to continue educational services and educational stability for a student, is to support that family in getting stable housing. So that's where it expands out past McKinney-Vento and the 16 educational requirements. You know, knowing what resources and that ongoing connection with resources, you know, beyond this McKinney-Vento liaison, we have a behavioral health coordinator. Oftentimes that is in parallel to the needs of the family. We have our physical health, our district nurse. We work in coordination of all 3 resources, because it's beyond just the stable housing, but we understand that looking for the needs of and serving the whole family and the whole child is the only way we can truly keep them in education and meet a 100% graduation rate for those families and students that are in such need.
And the only thing I would add is the main thing, we keep the main thing, which is graduation, student learning, and post-secondary enrollment. That's our main goal and the main reason why we exist. We look really closely at the data of the students that are at risk for not graduating. And that gap in those, we look closely at each and individual, students have different stories, and we look at those barriers in which we need to remove in order for them to be successful. This is one of the barriers that we have found that makes a difference in helping them be successful and graduate, is stable housing.
Question on budgets, and don't interpret anything as being critical or being negative here. If we have things that prove that it helps some of these kids break out of this cycle, I don't usually have a problem. I'm just trying to understand how it works. You're in 2026, looking at your site, it looks like you passed a $97 million general fund budget. Are you restricted on how those funds go? I mean, you can't find 40,000 in that. I mean, I'm trying to get, when you pass that budget, is it restricted? Are you saying this has to go to teacher salaries, yada, yada, yada? We don't, these funds that come from the state or come from taxes for that can't be used for these type of things?
Absolutely, it does. We have the ability, there's what we call our general fund that allows us the ability to focus
So
dollars
it gives you some leeway.
where we need to, for sure. Absolutely. That is true. And I will always be a superintendent that seeks alignment to additional grants out there. That's my job, to look for additional alignment with grants that are available, to then the ability to free up some general funds that might go to the next barrier that we need to remove for students. So
Yeah.
I do definitely have the ability to do that. This one does really nicely align with the vision and mission of this grant. And so I will always reach out and seek.
Understood. I was just,
What differentiates, excuse me, what differentiates the success rate of people in the McKinney-Vento program to be 100% successful versus only 90% for the total enrollment?
One-on-one interventions and hearing the stories of the students and families and removing those barriers. And the rest, we continue to look at closely. Some of those students that are not on track, we have different needs and different barriers. And so we are still pursuing, until we reach 100%, we're still not there. We just have an incredible program that really supports the needs of our McKinney-Vento students.
So I'm not saying I'm opposed to this, but this thought popped into my mind. What if my child is in that 90%? Don't they deserve to get the one-on-one to get to be a part of the 100% also?
And that happens, and they're successful, and that's why they graduate and are post-secondary enrolled. It's the remaining, our last was 92%. So we look at that remaining 8% and really look at those individuals and figure out what that looks like. But the remaining, they're finding success, and that's why they're graduating. We have other challenges that with post-secondary enrollment, but we do have 92% of our students that are on track that graduate, which is almost 10% higher than the state.
Yeah, I'm not disagreeing with you,
Yeah.
Mary Beth. I'm just saying, if we're gonna allocate funds and we have results where we're getting 100% graduation, what about the rest of the student body? Shouldn't they have the same one-on-one attention to increase that, that graduation rate also?
For this particular area, it is per qualification. So these students qualify, we're required to provide those services. We've expanded it. So it is a person that we're required to have within our district to support those 16 areas of education, and we've done better. And that's where this additional need is coming from.
Yeah, it's just a point that I've looked at where there are school districts that bus kids with special needs to and from school, and they spend $140,000 a year in transportation. And I'm like, why doesn't my kid get that? That funding allocated to the education to the rest of the kids. So it's just, to me, I look at it, and I'm not saying that that I disagree with the program. I'm just saying there are parts of the way that the system is set up that I take issue with. But it is what it is at this point, so.
This is part of the a consolidated grant fund.
Yes, so what we were looking into was the Consolidated Homeless Grant.
And this is the fund that we actually had you go out because we turned so much of it back the 1 year. Is this the one where we ask you, what are other counties and stuff doing? Or am I
Might-
thinking of a different?
You might be thinking of the foundational public
Okay,
health.
I am. Okay.
Yeah, yeah.
Sorry.
That's okay. The Consolidated Homeless Grant, we see every 2 years from the state. This year's allocation was about $11 million. We currently have about half of that allocated in contracts with providers. And so when the school district reached out, we were looking at that as a potential source of funds.
Okay.
Yeah. So what the state said, in the state also learning about the work that they're doing, is that they could fund pieces that were really specific to serving individuals and connecting with homeless resources. There's some other functions, more academic and school related, that the Consolidated Homeless Grant couldn't support. So, if we move forward, there's some work for us to do in terms of defining what that looks like.
Yeah. And I agree with the superintendent. Part of her job is to see where we can find grant stuff and then mix it with their general fund dollars. I get that.
Sure.
So do we not know at this point then what percentage of the 40,000 is qualified and what is not? Is that what you're saying?
It sounds like you may have done an initial
Yes.
percentage based, and the state has given us some guidance on how we move forward with that. And so we would take a look at that and how, and how you got to that percentage and work with the state to figure out exactly what that looks like. I'm guessing what it would look like in a contract is a dollar amount that would be up to is, what our standard in terms of contracts, an up to dollar amount. And then within that would be the certain eligible activities that the person would be doing.
Are you open to any comments or questions from the public? I'd give you a chance to ask or comment if you'd like. Put on my glasses.
I do. And I apologize, I didn't quite get your name. It was said so fast, I just couldn't quite hear you.
I'm Gunnar Guttormson,
Gunnar,
Director of Student Services with Kelso School District.
Wonderful. And thank you. It's nice to see you again. And I'm looking here at the unaccompanied youth, doubled up or living in car. And that's what determines homelessness, correct? And that's how they are qualified under the McKinney-Vento. And I'm wondering if do we prioritize? I mean, doubled up to me sounds like I'm staying at grandma's house. So are they just put into the program? I mean, how are they qualified?
So there is priority continuum. So some of our McKinney-Vento families are doubled up, and that is it is stable. They still under federal guidelines, they still qualify, and so they may not have the same resource needs as the family that's living out of their car or is temporarily doubled up just in a transitional time period, maybe a week or maybe 2. It's just so that because maybe they lost their housing previously and then they found a friend or a family member where they can be temporarily there. But that would also be doubled up for that temporary time.
And so are they given if somebody's doubled up, they're in a safe environment, are they given as much priority? Or are they just automatically shuffled into the system because they're deemed doubled up?
So they qualify under federal guidelines for McKinney-Vento, but then our liaison does prioritize who needs housing. So is that doubled up situation a safe and adequate housing situation for them? Or is it really an accommodation that is adequate for 2 or 3 people and then there's 8 people there? So there's those considerations through that housing questionnaire to really understand the circumstance for the family and the student.
Okay, alrighty, thank you.
Yeah, you're welcome.
Is there any, Gunnar, I see that you guys have it since 2021. Is that when the program started?
Correct.
Okay. Is there any follow-up with any of these families that you guys worked with that you have the graduation rate that you do, but is there any follow-up with going back with some of the families that were involved in the program and what they're currently doing?
There is ongoing informal connections with families. It depends on where does that, after the student graduates, is the family still within the area? Do they, they may reach out for additional resources, but a lot of times, as we know with stable housing, things tend to move forward for families. And then, but for students, there is ongoing follow-up with the students. So the 20 graduates that we had that are in post-secondary programs this year that graduated last spring, our liaison is still connected and was just talking about one of our students that she was concerned about not staying in, and he has confirmed he is returning after break to school. So.
But that does pose a good, I wrote that down. That is a good to receive some feedback from families or students of what worked, what didn't work, to help improve our system. So wrote that down. I think that's a great idea.
So do you have kids, like, let's say one of them is a freshman, they're in the program, and then they get into stable housing as a sophomore. Are they reevaluated every year? Or do they just stay on the program until they graduate? What does that look like?
Yep. So it is a yearly program, and so also additionally part of our expanded program is this is a full-time employee. She's employed throughout the school year, and her summer work is connecting with each of the 300 plus families to verify what their housing situation is and continue to try to connect them with services.
Ron, there's a couple comments that I'll
Go ahead.
just read through if that's okay.
Sure.
One's just a spam advertisement here. And these comments they're available to anybody that's online. And I think you answered a little bit of what this other one is asking. Why does it make sense to get schools involved in the welfare system? Also, we heard nice words about the success of the kids in the program, but show us some figures that are traceable. Graduation rates mean nothing, especially when we see that the graduates fall short of competency in many programs, yet we already have spent circa $250,000 per student from K-12. Ron?
Okay, hey, thank you. I heard some very welcoming words regarding your unstable housing. One was family wholeness, very important criteria, and then also stable health. I come from the old world where my mother was a school nurse. She made house calls. Health was also very important as far as stable housing. So, but what I didn't hear numbers. I hear $40,000. What I like to know is that 2 students, 10 students, 20 students, what is kind of your connection of personal contacts, not only this year that you're looking at, but just like you just said, a couple of years back?
So I can answer both the online question and Mr. Kozlowski's question. We started tracking post-graduation college or apprenticeship this last year. So our focus was the students that were in front of us before, but as we've understood the importance and our goals for Kelso School District in post-secondary graduation readiness, we're also tracking that. And right now we have 100% of those 20 students last year that are still in post-secondary certification. So that's 1%. If we get 1% on our Kelso School District graduation rate, that is a success overall. So when we have 20 students that statistically are less than 50% at the state graduating rate, and we're at 100%, we feel like we're doing our community a great service by helping contributing members result from these supports that are happening within our school.
So to paraphrase it, you're saying there are 20 students participatory in this $40,000 program that you're proposing or funding?
From last year, right?
Yes.
So the breakdown of the 40,000 is actually servicing 262 students right now, experiencing homelessness. So breaking that down is that $40,000 working with Gina and the state, it's about 30% of one person's salary plus an additional. But that total $40,000 ask goes directly to 262 of those, of our identified homeless students.
And last year it was 287. So 20 of those were graduates, but 287. So another, so 267 were other than the 20 that serve those, McKinney-Vento serve those students.
Okay, thank you on that. And that's just to test your criteria a little bit. As an experience, when I graduated from high school, my cousin moved in because the family was moving to another location. He wanted to finish his year in the local school district. So he occupied my bed for a year. Now, hopefully, under your criteria, that does not qualify as unstable or homeless.
So it sounds like the family was part of that decision and it was a pretty stable situation. So it would probably not.
I would hope it would not.
Yeah.
Right.
That would create an unstable situation for a stable situation. So,
Right.
okay, thanks.
Yeah.
Thank you.
So there's 220 plus kids that are throughout Kelso School District that are qualifying for this program.
As of September.
Yep.
So we'll get another run of those numbers. So those numbers will only increase throughout the school year.
So this data here is really pertinent to graduates, seniors.
The 100% correct, but you can see that just past total enrollment, we have the enrollment of McKinney-Vento. That is the work that happens during the summer. So we had 287 students, not all returning, because 20 graduated, but that is the work of our liaison going and working on with those families to verify, do they continue to qualify for McKinney-Vento? And then we started this year with 262, but we have families that housing situations change and or move into the area or drive into the area. And so those numbers always go up.
I think right now we have about 20 seniors that we are working very closely with to get them to that 100% graduation of the 262 currently identified, our seniors.
Thank you, Mary Beth and Gunnar, for your hard work in leading the Kelso School District in this program. Just on behalf of Community House on Broadway, we're just so grateful for your partnership with our programs and the students and families that we've been able to serve in conjunction with your program and your liaisons specifically. But just recognizing that 5 or 6 years ago when you started this program, expanding beyond the federal requirements of McKinney-Vento, but expanding it to really address a more holistic approach in supporting these students and family structures to be successful in the long term. That really takes courage and it takes risk. And we're grateful that you've been able to model that in this community and that Cowlitz County has a district such as yours to really set the stage for what other districts can do. It's unfortunate to hear that that has then caused a more competitive bidding process to actually go out and find the funding to expand those programs. It's a good problem to have in a sense that other districts see the vision and see what can be done to help family structures, but it definitely Community House on Broadway supports just this great program that's going on and we would encourage the commissioners to really take a good look at the funding request and see the good work that the district is doing and as they try to go out and look for funds so that other funds can be utilized appropriately. So thank you guys for your great work. Thank you, commissioners.
Thank you.
Thank you for the partnership.
Mary Beth, I had a question. Is there one of the issues that I have with government is that it just continues to expand and expand and expand and expand. Do you guys have, and you may not have an answer to this at this point, but do you have a system whereby, you say, okay, we're not going to do this because this goes above and beyond what we want to do or what we're trying to do? Do you have a board? How do you guys, how did you decide to expand it, number one? And what system do you have to keep that in check, so to speak?
Well, we had the reduction of one staff member. So we did have 3 and now we're down to 2. So we've already had to with budget challenges and being fiscally responsible to our taxpayers, that was one of the reductions we had. We are running a very lean machine right now that helps service this. I don't know if we can reduce any more. And we're asking a lot from our staff to deliver the same services we had with 3 people. They're doing it and they're doing it really well. We have incredible staff, but that is our checkpoint. We can't expand anymore, and the needs of our kids are coming with us with more challenges.
So the financial part of it is by default your checkpoint.
Yep. Well, that's one. Another one is we look at results and supports, and is this getting us the outcomes that we want? And it is. So we will continue to look at ways to support that, because the outcomes, it's hard to deny that this is an incredible support program for our students and the family. So, you know, as superintendent, I look at outcomes and what is getting us results with students, individual students, and this is definitely a program that we will continue to figure out ways in which to be creative if we have to.
In addition, we use those 16 educational guidelines from McKinney-Vento to kind of look at what is our responsibility. This has expanded as an essential need to support those. There have been many other opportunities where we focus on our work. Can that be something that we take on? And the answer has been no. So there's been several things that we have not taken on that could not be our responsibility, just because they don't fit within the 16. And we understand that they would serve the needs of some of our families, but this is, you know, housing stability directly allows us to serve those 16 areas of educational need. So we do take that lens into it.
And that's your responsibility as you see it.
Correct.
Okay.
So if we didn't have this, is this program important enough if there was not this available and the state isn't available? Is Kelso going to do it anyways? Or would you just let it go away?
It would not go away, and I would go and seek other meetings like this in which to champion the cause.
Okay.
But I do think it really aligns well.
I want to know how important.
Yes.
It is very important.
Essential for our
Kelso
kids.
School district.
Yes.
Yeah. You're no stranger to that.
I know. Good morning, commissioners. Hello. So I wanted to speak just briefly as a community member, not as a staff person. My children go to Kelso schools, and I've known of other kids who have benefited from this program, although minimally. I don't know a lot. But my 17-year-old went through a phase of refusing to get new shoes for about 2 years. And he came home with a brand new pair of shoes one day. And I'm like, where did you get those? And it was noticed by, I believe, their head staff person who runs it. Is it Mrs. Baldwin? Is that okay? Gave him a new pair of shoes. And I was like, oh my gosh, you have to give those back. You know, and that's my little anecdote, but I guess I'm saying that in a sense that they are in the community, they are helping children. And I think that their model's a little bit different in that I think it's going to fit kind of what this board's been supporting in the homelessness funding. Kind of, it breaks the mold. It's not so much what we see typically in these requests. And I think I've come to support Habitat from a community's perspective as well as Family Promise. And I think this kind of fits into that. It's a little bit different of an approach. It's not a multi-million-dollar operational request. I think it's something different. And I've seen it kind of just in a small micro version with some friends of my children. And so I just wanted to make sure that I came up. I didn't plan to be here, but I'm on my own time and not speaking as a staff member. But years ago when Commissioner Dahl came on and kind of wanted us to tackle, myself and a couple other staff members, how we look at affordable housing, how we fund it, what are some barriers we have at the county level. This isn't necessarily affordable housing. However, it does kind of, like I said, it fits into that model of looking at things a little bit differently and tackling it from a different approach, and hearing that they're the only school district that does that and try to take something on and do a little bit different, I think speaks to that. And so I just wanted to have an opportunity to share quickly my 2 cents as usual, right? So thank you.
Thank you.
Morning, I'm Mike Foss, I'm on the Council School Board. And since this program was initiated, to me, it's been one of the most successful programs I've ever seen implemented in our district. The kids that this program serves have some serious challenges, right? All kids have challenges. These kids have some serious challenges. And the fact that have some years where 100% of these kids that have these challenges are graduating due to the efforts of this program. And the fact that they're going on to get more training is remarkable. And you asked about expansion. The last several years, we have to live within our means, as do you. Our funding comes mostly from the state of Washington. Some of it comes from our local taxpayers with our levies. A small amount comes from the federal government. We've had to make cuts in the Kelso School District. We're not expanding our staff or whatever. We've had to reduce because we live in tighter times right now. And to me, homelessness is a very complex issue. I don't pretend to be an expert at it, but to have kids get out of that cycle and go on and get something tangible that maybe they then can become a taxpayer instead of a tax user is an incredible investment. And as long as I'm on the Kelso School Board, we will continue this program. And I know Mary Beth is very passionate about it, and our district and our board is very passionate about it. I also think that it would be an incredible investment for the county to help out with it. So thank you for listening.
Any other questions, comments? Are you just looking for us today if we give you a head nod to work further on it, or are you just trying to see if you should go forward or you shouldn't go forward?
Sure. Or if you feel like you want more time to think and ask further questions, we can circle back to at a later date, whatever the board is comfortable with.
What's your guys' pleasure on that? Do you want?
Well, my personal opinion is of a lot of the things that we have had brought to us, this one is pretty transparent. It's very clear that they have data. I'm in favor of moving forward with it today if you guys are.
Well, we'd get another chance to review it because it would come back through us in kind of a contract form, I'm
Right.
assuming.
Yes.
So there'd be another chance for if we have questions that pop up, we can get those answered, and public would have a chance to weigh in again, right?
Mhm. Yep.
Yeah. So Commissioner Farrell, you good with that? Yeah.
No, I guess I'm okay with it.
Okay.
Yeah.
Okay. I'll continue to work with the school district and bring back what would come back as a contract, so we could take a look at it. Continue to work on the specific duties and activities that align with the contract and go from there.
All right.
Okay. Thank you.
Appreciate your time today. Thank you for coming and joining us.
Thank you. And I'm very grateful for all of it. Thank you.
Appreciate it. Anything else from the public before we adjourn this thing? Looks like we're all good. Okay, we will adjourn. Thank you.